Hi, my name is Matt. I'm a clinician with Criticare Home Health Services located at 6th and Main in Lawrence, Kansas. This video is designed to inform you of the best methods to keep your PAP therapy device clean and functioning correctly in the safety of your own home. First, unplug the power cord from your device. Before you move your device, make sure you've emptied the water container. You don't want water to get inside the device. It can damage it. The most important step you can take toward making sure that your CPAP remains functional and reliable is to replace your filter every 6 months, just like you change your furnace filter. Most of the filters we provide are designed to last 6 months and can then be disposed of. Here's how you replace your filter. Remove the dirty filter and dispose of it. Insert your new clean filter. A clean filter protects your device and improves the quality of the air you breathe. To clean the device, we recommend using disinfecting wipes like the Citrus 2 CPAP mask wipes we sell at Criticare. Simply wipe down the outside surface of your device, including the area that houses the water container. Do not spray cleaning solutions directly on your device. We recommend cleaning your device every 6 months. Don't forget to use only distilled or reverse osmosis water in your humidifier. If you feel like your device is not functioning correctly or your device displays an error message that requires our expertise, please call us. We will try to troubleshoot over the phone. We may ultimately need you to bring your device in for diagnosis. With a few short steps, you can keep your device running well and improving your quality of life for 5 years or more. We are here to help. If you have questions that are not answered in this video, please contact us. You can reach us at 785-749-4878.